Welcome back, everyone, for this roundup session. Really short and sweet this is going to be. What I would like to do is make you aware of any sessions that you might have missed today and encourage you to go back and have a look, catch up on some of those, share that with your chums, anyone who might have been interested in any of the sessions that we've put on today but they perhaps haven't been able to access. They are available on Catch Up. So thank you so much for those of you who have joined us today. We wanted to develop a programme that really reflected those issues that are affecting us at the moment and coming up with some new solutions for you. And we'd like to think that we've done that. Hopefully there's some take-home messages for all of you. And I'm just going to run through some of my take-home messages. But I would just like to say that we have had a record number of people signing up for issues and answers this year, which is interesting with the remote way of doing things. So we're well over 300 people, closer to 400 people, in fact, registered. Just starting off with Sarah Jarvis. What a way to start. If you missed that session, seriously, you need to go back and catch up with it. Very, very outspoken as usual, very much giving her opinion on everything that's going on COVID related, but some really, really good data, some really good references in there to back up all the things that Sarah was saying. And I think one of the key messages that I got from Sarah was that it's never too late to do everything that we can to protect patients who may be at increased risk of coronavirus. And it reminded me as well that we've also got some guidance from Asthma UK that's recently been published about restarting respiratory services, because Sarah was saying it's so important that we do make sure we're available to our patients, as indeed the vast majority of us are. So it's really important to make sure that patients understand that we're there and that we are engaging in healthcare, maybe slightly differently from how we normally do. But that was a key message that I picked up from her, that we need to be out and proud about being primary care healthcare professionals out there doing the job that we all love doing. Another thing that I picked up from Sarah was the University of Oxford's risk algorithm for COVID, which I'm going to go and have another look at afterwards, because I think that's really important. I thought it was very, very interesting to think about how we might be able to work out the patients at highest risk of a poor outcome from coronavirus and really focus on protecting those individuals. We then had the session on atrial fibrillation, where we heard about the importance of detect, protect and perfect. I love that message. I think it's such an important one. You know, find these patients, protect them from the risks associated with atrial fibrillation, and then don't forget that each patient will need their own particular treatment that will be tailored to the individual that they are. So that's a really important message. And there was a nice treatment algorithm in there to help you understand how to prescribe. Some really good questions in that session as well, about things like how renal impairment affects your choices, and also reflecting the fact that a lot of patients, their renal status will change. So even though they might have been okay in one particular situation, when you check their renal function last, their renal function has actually deteriorated, and that's changed the perspective for them. I really enjoyed Yassir's heart failure session. I'm a big fan of Yassir. I must say, anything that he presents fascinates me, and he did it with his usual panache, focusing on the importance of diagnosing patients with heart failure, managing them appropriately with pharmacological interventions, but then reminding us about the importance of devices in people who might at first appear to be end-stage heart failure, where we're thinking of palliative care, but actually recognising, no, hang on a second, there may be more that we could do. So if you want to know more about that, revisit Yassir's session, which was superb. I was also blown away by the obesity session. I mean, goodness me, I've not seen Rachel present before, and I really was fascinated by the new language and new approaches to obesity that she spoke about. Really, really interesting to see the way that that we talk about obesity can affect people just accessing healthcare, you know, actually putting them off coming in to see us. So I was really interested to think about how we get around that, and as well as the new approaches, new dietary approaches, medication that can help. And then we had our session on familial hypercholesterolemia, which was as interesting as it always is, just reminding us that there are people out there that if we find one, we are likely to find a cluster of people because of the familial link there. So really being very careful about finding these patients, referring them, making sure that they're actually getting treated in the most appropriate way. And again, I heard that message in that session: detect, protect, and perfect. So, you know, coming out the same as it did in the AF session. So I'm taking away lots of really key messages from today, and that's just day one. We've still got day 2 and day 3 to go. Goodness me, my brain will excitement. So do enjoy the rest of your evening, those of you that have joined us live, and I really look forward to joining you again for day 2. Thank you very much.